Everyone, this is Shelly. Shelly is a dear, dear friend of mine. Shelly, I mean, this is a completely different, like, we won't, but one of the ways that I know Shelly, she's actually illustrated a children's book that I wrote, and you can see some of her, little bit of her beautiful artwork behind her. It looks like you're in your studio.
I am. Yep. I
Nice.
just feel like if I come up here, I'm comfortable.
Yeah, awesome. Well, it looks like a really cool space. I'd love to hang out with you up there. So anyway, Shelly has been such a tremendous help, especially like right out of the gate when we found out that Ashton had Chiari, because she was the one person that I knew would understand and I knew would be able to help me, and help in ways that no one else was going to be able to. So I mean, I immediately reached out and I was like, hey, this is the diagnosis, and is this what you're like, yep, this is that's it. And we scheduled a time to meet, and again, I don't have Chiari, so I don't know what it's like to experience firsthand, but from a mother's perspective, being able to put you and Ashton in the same place at the same time, and then just kind of get out of the way and just observe. And because of who you are as a human, because you carry so much compassion and love with you that you so easily offer to other humans, it was such a reassurance to me that he could have a conversation with you, and that he could feel seen and understood in a way that he wasn't able to have prior, even before the diagnosis.
Right. Yeah.
Because when you don't have a diagnosis, I mean, that's, I think, probably even harder, because you don't know, you don't understand what's happening in my body. Why is this going on? So having the diagnosis and having the conversation with you is like such a pivotal moment for him. And it was interesting to watch. It was really interesting to observe, because the questions that you asked him that I had no idea. Like, I was like, what? Like, I had no idea that he was experiencing some of the symptoms that he had. Mm-hmm. And he'd been experiencing them his whole life. But for him, that was his baseline. He didn't know that wasn't normal.
Right. So that's something that kind of blew my mind when people started putting all the dots together and connecting things. Mm-hmm. There were symptoms I had as a little girl, and when you grow up with them, they are normal to you. And then you find out not everybody has this symptom. I live with this. And so, you find out later, it's like, no, that's not normal. And then you kind of just blows your mind, because you're like, don't know anything other,
Right. Can you give me an example of a symptom or two that you were surprised that not everybody experiences on the daily?
Well, one that developed a little later, I can't remember it necessarily as a child, was this feeling of my head crawling. Like, mm-hmm. Like, I was so paranoid. I had, like, what the world? It's nerves. And they would just sit there, and almost like there's bugs crawling or something. And that was something I would just get super paranoid about, but it was, it's the nerves from the neck and all the situation. There is another one. I'm not sure what you want on here.
Whatever you want. I don't have it. There's no boundaries as far as I'm concerned.
All right. So I found out through good friends, and you're a good friend, and now it's going to be public, that if you are using the restroom and you apply pressure, it is not normal to almost pass out.
It is not normal.
So, I'd be like, whoa.
Oh, wow.
And it's not a good place for that. So that's something since childhood that I mean, I remember very young having probably what's now, and I don't ever say this right because I've had many specialists say it different ways, but dysautonomia or POTS. Now, dysautonomia has 15 different types, but I say POTS because that's what people are familiar with. But that's when your body's not automatically regulating things. Normal bodies do. So, like, some people who stand up might pass out. So I've had that for as long as I can remember, not knowing, but it intensified later to where I really really had to have that treated. That's a side or comorbidity of Chiari. So,
Right.
so yeah, little things like that. I had the headaches.
Mhm.
I remember my mom putting a cold rag on my head, seeing all the flashing lights. When I try to sleep, I can see things flashing. That intensified so much later also,
Mm.
you know, to where it was disturbing my sleep big time. So to in perspective, it would be like closing your eyes and seeing snow and kind of things. Enough as a
Mm.
child, you look at it and think it's pretty, but you don't understand
Right.
why. I'm just like, whoa. And then later in life, closing my eyes, and it was more bright and stimulating to close my eyes to try to sleep
Oh,
than it was to lay there with my eyes open. I got down to
wow.
2 to 3 hours a night of sleep. And
Mm.
sometimes you could feel them twitching and moving around my eyes. So those are things that I would say I have always had, but then intensified in the last couple of years prior to
Yeah.
trying to be treated. So
Yeah. So you had all of these things that were sort of your baseline that you just assumed that everybody else had those experiences.
exactly, yes.
And so do you remember like when you realized, oh, was there a moment? Was there like
Um,
a specific doctor or a conversation that was like,
yeah. One, I can even see my teacher friend, and I'm starting to figure that out. Like the one I told you, that's a little humorous, you know. Um,
Mhm.
uh, I started realizing the pressure that's so much in my head and how it's affecting things. And it hit me on my own. And I started
Mhm.
asking my teacher friends at the time, because I was
Okay.
teaching then, I'm not now. So I started asking, and they're like, no. And then I would ask someone else, like, you know, do you have, you know, I was like, man, you know, you get paranoid, you know, I worked at
Mm.
a school. So of course I'm like doing this, but there's
Oh,
nothing,
right.
right? And so, you know, that it was kind of like that. And then it took a while to have a doctor validate any of it. It was
Yeah.
always separate symptoms for separate things. Um,
Mm.
my best doctor that validated it was the one who found it in the very beginning, and that's with our local clinic in town. Did the MRI just to make me feel better, because the symptoms I was having was similar to a stroke and or something
Mm.
worse. And they're like, just let's make everything feel better. Let's take a look and see what's going on. And even they were unfamiliar with what it was at the time.
Yeah.
And but they said the symptoms line up with what you're experiencing, you know. And
Yeah.
that was validating to find something.
Mhm.
And then it went downhill from there.
Okay. So let's get into it, because that is definitely part of the conversation that I think, and this is just from my observation, right? So again, I don't know what it's like firsthand, but I'm watching these conversations on some of these Facebook groups, and it just seems like it's so repetitive, these comments that people are leaving about the symptoms that they're having, and they're being told that they can't possibly be from Chiari, and that they're just being dismissed. So that's
Right.
my very fast way of explaining what I feel like I'm reading. But I would love to hear, like, I just want to know what you have to say about that, like the validation piece, and or the missing that, like, how long were you missing that?
I went an entire year. Um, I would say from doctor to doctor to doctor. And then that's when we really hit it hard. I can look back till 2010 going to the doctor for something, but it
Mhm.
was very kind of vague in here and there. And then again in 2015 and trying to go and like, what is going on with me? But then in 2018, I was painting a mural. And from the beginning of it in May, I went in, they did find Lyme. It wasn't until October they found Chiari. By then something was just coming on so fast. It was like I lived with it before. I knew something was wrong, but now I'm losing body control. So like I would try to paint and drop my paintbrush, and I was not having grip. I was losing motor skills and control. I started losing control of other aspects of my body. Like I couldn't even speak of it because it was so humiliating. Like Well, humiliating, it never happened in public, but there's a risk of bowel and bladder loss of control. And I'm
Yeah.
teaching, and I can't, I would just be like, I have to go, and I would run, and so
Yeah.
then they sent me, when they found that diagnosis, to a university medical place. That was the first one that made me cry, because it was just anxiety. And I had migraine. So then
Okay,
hang
on now. Like I just
Okay.
like just one tiny little time out. You were told it was just anxiety.
Yes.
And migraine. So I just want to make sure that that's clear for everybody, that you had gone in with all of these symptoms. You're saying, I can't hold my paintbrush, I'm dropping it. You're expressing what your daily life is like, and you're expressing clearly that it didn't used to be this way. And that it's progressively gotten worse, and it's to the point where you're not able to do your job.
Right.
And the answer was, and actually, let me ask, did they do any tests, or was this just all like conversationally? They were listening and came to that conclusion, or did they run any tests or take any images or anything?
They began with looking at the MRI and said
Okay.
that, yes, you have Chiari, but it's not bad enough to cause all these symptoms. And I think I was at 7.5, and learned way later with a good medical professional and through the Facebook group that it's more about the circumference or the girth of the brainstem blocking it, not necessarily the length. So he's the one that first said anxiety, which he was the one causing most of it in that room. and that became a norm. I just sit there and start going like this before every medical thing, because they are making me feel like I'm crazy. And then so he referred me to a regular neurologist to treat migraine. While I was in there, he said, okay, so let's test your hands. He was noting the motor skill thing. And I had to go back for the test. What's it called, where they test with like electrical shocks all over to see if your nerves still work?
I have no idea.
Shoot, I forgot the name of it. So I laid there while he did these little shocks to see what nerves were working. And the funny thing is the day he ordered the test, I could not operate 3 of my fingers. I didn't have the power. I couldn't, and I'm a competitive person. So when a neurologist says, hold against me, don't let me, I'm going to win. But I couldn't. So then I know it's not just me. And so these 3 fingers don't work. He suspected whatever the itis is that's in your elbow from like lots of use. And so we came back for that test that day. These worked, the regular physical, and my thumb and forefinger did not work. I couldn't operate them. And he goes, well, there is some damage in your elbow and all this. And of course, my husband's just getting livid, because he goes, boy, you threw me a curveball, because now your other 2 fingers aren't working. And that has to do with different nerves. And, but basically that's the end of it. Your motor skill problem is a nerve in your elbow. We can treat that. And we're going to give you a lot of medication for your migraine and your anxiety, which did nothing but make me feel crazier. And then when I called and said, we're talking, I'm rocking, I'm crying. I was gotta be the medication. I don't know what's going on. And they said, you need to give it a full month to adapt. I said, I can't make it a month. There's no way I'm going to make it a month. And what I was implying was that it made me go so depressed the opposite way, that I couldn't live like that for a month, and so I got off of it myself. And so we changed universities at that point.
Yeah. Wow. So
that was
they did all of this all happened with, I just want to make sure I'm understanding. So all of those things happened, and they knew that you had Chiari. That was on your chart. That had been established by that time. And these are neurologists?
The first one was a neurosurgeon. He referred me to the neurologist to treat migraine and anxiety. And then the neurologist decided to do the nerve test to my elbow. And that was causing all my problems.
Okay. All right. Sounds terrible. I mean,
and I don't know if you wanted me to go to the next one or just let you ask the next question. But so the next place was, I had a better neurosurgeon, and she at least listened a little bit. And
Okay.
she said, we're going to start with a sleep test and see if you have sleep apnea. If it's obstructive, then it's not related to Chiari, and it may not be Chiari causing your problems. If it is central, which means it's coming from your brain, that'll be different. So went through the sleep test, I think 3 different times. I sat there, they diagnosed it as obstructive. The first 2 times I went through the whole thing, and I messaged the nurse. I said, why is everything, because you can, it's actually readable. I said, why is everything saying my brain is the cause? It's stopping my heart from breathing in the night, because my heart rate would drop in the 40s. That was like normal. And back in 2015, I almost didn't get released from my appendix surgery because my heart rate was so low, and
wow.
I held my breath to make it go up. So
Oh, wow. Like, let me just hack my body.
yeah. So she actually responded back, and that was positive, because she said, you know what, you're right. This is misdiagnosed. It is central sleep apnea. Let's look into the Chiari aspect a little more. I went through ear, nose, throat doctors. And there's various ones, all the tests. Each one would argue that the other one was wrong.
Oh,
and
no.
I had some throat doctor saying, I know what all your problems are. It's a lack of oxygen. Because I was telling them swallowing liquid, I would choke, and that's a symptom of Chiari. And so anyhow, he would argue that no, it's not this, no. And then this doctor goes, no, that's not what it, I'm like, sit down at a table and get your ducks in a row. But that was one where I snapped. I mean, when he said that, I had gone through so many, going back and forth about 4 hours to this doctor and doctors, and I finally snapped. I mean, I stood up, I started bawling. I mean, it was messy. And then yeah. So it was just, the anxiety and all of it they cause, and they think they know if they're treating each and every little thing, where you can have over 100 different symptoms with this, and you can't treat every one of them, so yeah.
So do you think that's what was happening? You think they were trying to figure out, like, they were trying to treat individual symptoms rather than kind of the whole picture?
Yeah, I do. Because when the one, I can't remember what this thing is called, that if it blocks oxygen, I mean, he did say, I think this is causing all your problems. And I'm like, all my problems, because of, some of them I told you about. And
right.
That's when I think it was just to that breaking point.
Yeah.
And then I get the letter in the mail that neurosurgeon, like, if I message just her, because these were individual specialists outside of her that she wanted me to go through, I get this letter saying she was leaving the university, and I somewhat liked her. So, I went a month just crying and spiraling because I couldn't find help. And I knew something was more so wrong than these individual little things going on,
Yeah.
And I say little mildly.
Right. Yeah. Well, they might seem, little if they were the only thing.
Right.
But, you were dealing with so many different things all at the same time. So how many symptoms do you, like, you've counted them, right? You've got the sheet and you're like, yep, checking out, like, check off however many out of, what is that, like 128 or something?
Yeah, there's a lot. I never did count them. I just sat there and filled out the same form. That form came later. After I joined the Facebook group, I finally reached out for help because I was in full depression at that point. And I decided to, that gets me, because it was rough, because I didn't think there was any help anywhere. And here I am losing complete control of my body. So I reached out in the group, and I even said, I live in this state. Is there, besides, I think, Colorado, I knew about where else? And that's when I came across, he was really, he was funny and a good guy. And he was out of Little Rock, Arkansas, and he cannot do anything medical now due to his own health reasons. But I would still go to him for checkups and then just see, but there was nothing better than finally getting in with him, sitting in that appointment,
Yeah.
It's by now it's November of 2019, and I'm sitting there, and he said, "You are 90% blocked off from your brain, the CSF flow to the rest of your body. We need to get you in and get that opened up." And he explained it not only to me, but my poor husband. You know, as a caretaker, you're
Right.
like, I don't understand the bug crawling in your. And I keep talking about that one because I've
Right.
already mentioned it, but
Yeah.
the weird headaches. Just imagine being on an inversion table for a long time, but you're up, you know, or you just you bend over to do something and come up and you feel like everything's going to go, just explode. And you laugh, you cough, you sneeze, and you maybe put down the rest of the day, you know, because the pressure was too much. And so he explained it to him, and he explained how I loved it because he said, imagine a wine bottle and the brainstem is a cork, and put that cork in the wine bottle, and you can't get anything around that space because it's blocked off.
Yeah.
And the way he explained, like my husband even said, he's like, I don't understand the water works. I don't understand why she's so emotional, and like just getting into almost a panic attack stage. And I can't remember exactly how he said it, but basically he helped my husband understand, if you were losing complete control of your body, every day it gets worse. Wouldn't you panic? And he, just the way he explained it was so down to earth. And that was heaven sent at that time in my life. So he by the end of that month we got in there, and that's how I partied on New Year's Eve. I was having decompression surgery.
That's a hell of a party.
Sarcasm.
Yeah. So that doctor, that was the first. I mean, I know you liked the female doctor that you had because she listened.
Yeah, she listened at least. Yeah.
She listened, and she was trying to help, but it was still like sending you to individual specialists for like these separate issues.
Yes.
Okay. And then, so then you see the doctor in Little Rock, and that doctor was like, yeah, this is Chiari. And my question about that is, was that the first time anybody had ever even talked to you about CSF flow?
Yes.
Yeah.
I didn't understand any of that, and it made a lot of sense once he explained it. And if I had seen it, I didn't really know what I was reading, you know. It was really easy to understand the way he explained it. I also had I think the common way to explain it was a shrinks. He found it. Both other universities missed it, and it was about probably right below my cervix area, and that is like a cyst in your spinal cord, because it's not getting the flow that starts to form. That's going to cause another additional way of blocking things off. But it was very small, and I will say that resolved itself. You know,
good.
Yeah, a lot of times I had read later that those are there forever and the damage is done, but it was very small. So I think that's what helped. So.
Okay, good. Okay. So you had surgery. You had the decompression surgery here in the United States. Would you mind just telling us about that? Like what? Yeah.
Well,
let's hear it.
Well, that was just loads of fun. So I woke up and I missed New Year's Eve, and it wasn't for fun reasons. It's also,
right.
It was it's a very long recovery. It was for me. He was very adamant about not letting me go back to teaching because it's little kids and you never know when one's going to hit you from one way or the other. And he said he wanted me to do the full 12 weeks when I asked him to go back at 11 weeks, you know. So the healing time in there were some things I'm just like I had like this different things going on that I felt like kind of were better, but nothing was instant. Like I've had a friend that said she woke up and knew it was the right thing that she had done.
Good. Oh, wonderful.
And I woke up and they accidentally scraped my eye in surgery. So that's anything.
Your eye.
So I had this huge scrape and they had to bring in an eye doctor.
Oh my gosh.
And so that like just leaning forward to spit after brushing your teeth.
Mm.
I don't think anyone realizes once you reach that whole area, everything pressure wise is out of whack. So
Oh,
you lean
wow.
forward and it's just like magnified pain just pounding in
Oh,
your neck
no.
because your pressure's changing and your body's trying to compensate, but it can't because there's a hole. And so it's like healing and stuff. This, I was probably there like 4 days or whatever, did the walking they wanted me to do, and come home, and it was you have to sleep upright for 8 weeks.
Oh,
And then
wow.
they extended it another, so I'm sleeping on a little sofa with
Yeah.
a bunch of pillows,
Yeah.
and to this day I have to sleep that way. There are things that
Wow.
the surgery didn't fix. I would say, like, I think where I remember, there's so much that I'm stuttering all over the place. I apologize, but like
You're not. No, you're not.
I remember the first year he's saying it will be like a 2-year recovery.
Mm.
Your brain, it takes a long time for it to readapt to things that are new.
Mhm.
And
Mhm.
I was reassured by that because I talked to someone uptown, and a loved one had like something like a big surgery on their heart or kidney. I don't remember what part, but it was a big part.
Yeah. Yeah.
And they said that doctor told him a year, and then your body starts to slowly adapt to
Yeah.
things being new. It takes time. And
Mhm.
I was told you spent 40 some years of your life like this.
Right.
I think I was almost 50. And
Mhm.
then now you can't expect it to just go like this. It has to slowly go back. And
Right.
so I was patient and impatient because,
Mhm.
different things would happen. And I remember leaning forward and panicking, thinking I had a CFS leak because water just started running out of my nose. I don't even.
Oh, wow.
Yeah. And then there's just so many different things. I did stay on top of the pain as long as I could with a painkiller. I couldn't take some because they make me weird, weirder. So just having to be so careful and all this. So I go to all these follow-ups. He was very good about lots of follow-ups.
Mhm.
And then we're in the 2-year mark. I still have these symptoms. I'm still doing this. I messaged the doctor and I said, I want you to know I'm trying. I don't want you to think I'm just sitting around, I'm still just doing nothing because I have a brain thing. I said, I am in the basement attempting to exercise and regain strength. I know how to do it lightly, and I'm almost passing out. I said, I get on my elliptical, and that was a symptom prior. I was working my way up to 5 minutes, and I would get on there. I couldn't go a few, like 60 seconds, and I would almost pass. So I said, I'm trying all of it. I'm trying to build strength. I'm, by then, and like a year later, COVID hit in there. It was kind of a bad blessing. Does that make sense? Because then I can teach from home. So I went to the whole next year, did my follow-ups. They space them out more. Everything was looking good. My spine is continuing to get worse. Which for some reason they don't know, it seems like a connection. People have a lot of herniated discs, and I'm over 10 at this point, and they're all
wow.
and so like they'll have days where it doesn't hurt, but they're like, let's just baseline, let's say it doesn't hurt as bad. And so and then there's days that they are just bad. So we go through all this. We're getting ready for year 3, and I'm pretty down because I seem to be going backwards. And I told him, he goes, well, you need 3 years of recovery. And then I didn't snap temper wise. I just felt the tears start rolling down my face.
Yeah.
Because now you're extending it,
Mhm.
and I can't do certain things still. And I want my life.
Yeah.
And someone took a switch and shut it off. And I'm high strung. I have goals. I have things I want to do. I don't want to like sit back. And I was starting to give up again, mainly because, all of that. And so then I find out he had a medical emergency, so I can't see him anymore. And since then I've been trying to start over because I am reversing. I know I am. So I'm not doing that surgery again. I know there's people that done it over and over, but they all have said when I read about it, like in the group and stuff, they're all like, every time I have this surgery, it's so many times worse than the first one. And so we're talking a big major surgery.
Right.
One person I read did it 12 times, still had no luck. So I know it's not a cure. It was to stop progression. But my last MRI, my new neurosurgeon didn't say anything about it. He said, still looks like there's a lot of space up there. And he said, but, let's talk about your spine, which was my main concern because my spine is like, I don't want to not be able to hike or go on a walk, just nature. I want to walk out in nature.
Right.
And so he's looking at that. Later, I read it and it said the Chiari site, surgical area has shifted. Well, what does that mean? Because they didn't talk anything about it. And
I don't know that I understand. You read.
I don't either.
Where did it say that? The surgical.
So you know how you have an impression that goes with your MRI. So you have the pictures, and then you have an impression that we have access to read. And there was a part regarding it. I did like the fact that they took these MRIs and compared them to my ones prior to losing my other neurosurgeon. So he since then this has it's now moderate or worse, blah blah blah, and it referred back to the Chiari decompression surgery, and it said it has changed and shifted. So I don't know what that means, but there has been changes back there, and I'm like, I remember a year ago telling a friend, I said, there's some things coming back. And I said, it scares me to death because, well, now I work for myself. You don't get paid time off.
No, you don't. No, you don't get a lot of stuff. Different ball game. Yeah.
So.
Wow. Okay. So did you have some symptom relief then from decompression?
Yes.
And would you say you still have some symptom relief or no?
I would say I'm not nearly like I was prior. So yes, I have some symptom relief. I just know I can feel it reversing. Like I can feel things returning. But I was able to say, I know it's been since 6 years. I can still say I have, well, let me back up. I'm sorry. I was saying for a long time, I have more good days than I do bad days. And that makes me happy because it wasn't bad day, really bad day. It was more, I would have good days. And even if that good day wasn't like someone without Chiari's good day, it was still good for me. Yeah. Now we're 50-50. And so that's where I'm like, I don't even know what question to ask. I know it sounds weird after all that, but what I've always had a lot of cramps, body cramps. Those have never went away like that. But I reached over to take my foot and pat my dog on the head last night, and my whole foot and leg went it just curls up and goes and then I'm just like, I don't know what I did, but and yes, I drink electrolytes, I do all the things. So
right.
Just part of it. But and that could be fine. So I don't know. I just have to figure out how to formulate a question to the new guy. Yeah. And that he has time to take it seriously. So but yeah.
So you have someone you haven't seen yet, but you're going to go see?
I've seen him once, and then they changed it because I guess the flu or something was going around to a telehealth call for the second one. The first one, he was very good and attentive. I thought, okay, because giving up someone is rough. And then this, he wasn't too bad, and he was good about taking his bones and showing you the problems and what your spine's doing. And he really didn't mention the surgery. He had one sentence about that, and that was, it looks like you still have space in there, so I wouldn't worry about it. And then he went on. Okay. So now the telehealth call was quite a bit more rushed. And it was a delayed call. He was late. So it was just 1 days for them,
Okay. So
But
what have you like, is at this time, what do you think his role is going to be? Is it going to be symptom management right now? What do
um,
you,
for now, well, um, I was considering
Mhm.
in the back of my mind getting all the MRIs and everything I needed to consider going to Barcelona,
Mhm.
because I can tell things were changing and I wanted a more non-invasive way of
Yeah.
handling things.
Yeah.
So my disc herniated. I went to the doctor because my
Mhm.
insurance has been denying every MRI, so I couldn't get updated
Ugh,
ones.
oh
So
my
I
God.
used my herniated disc that day, went to
Mhm.
the doctor, and
Mhm.
that got the insurance to cover my first lumbar MRI. And then I went to him and I said, look at my past MRIs. I have a lot of issues. We were following them. I need more updated ones.
Yeah.
And we were able to get it through insurance to get a couple more. So
Good.
I honestly, that herniated disc pushed me to
Mhm.
find a doctor to at least, if anything, get my MRIs because
Yeah.
I didn't have anything updated since I
Uh-huh.
lost the other doctor. So, and then I thought, let's see what he's like. Let's at least see it. And I brought
Mhm.
up Spain to him and he just shook his head, you know, and
Okay.
that's kind of the response. If you
Okay.
bring them up, they're like, now they're
Yeah.
talking about this. We can look into that here, you know, and there will be something different like tethered cord, you know.
Mhm.
Um,
Mhm.
so, and I was like, okay, you could at least hear me out.
Right.
You know, like, but you don't understand. I know someone.
Right, right. So you brought it up and it was like kind of what I think I hear you saying is it was immediately like dismissed. Like it was obvious that he didn't want to discuss it.
Right. And
Yeah.
it's almost a feeling of anything outside the country,
Uh-huh.
you know, it's just wonky. You know, like,
Mhm.
no, no, no. And then I can't remember who it was I said other thing. And they literally kind of, I said it to another medical professional and they literally looked at me and go, and then like a shake and then goes back to write what they were talking about.
Right.
And I'm
Right.
like, you know, it's just odd to me that outside opinions from other places are dismissed without even asking more questions, you know, like, well, this is what they're doing here and they're doing
Right.
it in several countries now, but not here, you know.
Right. Right.
And
Right. I see that
so,
I see that there's a location someplace in China that
uh-huh.
I've seen a few people post in the one Facebook group that they've had surgery there and are doing really well. So I don't know what the differences are. I haven't done any research. But yeah, I'm like, I hear a lot of that too, like what you just said, and I see a lot of it. And it's frustrating because, but I mean, like, well, obviously it's frustrated me enough to do a podcast about it. Like,
Mhm.
here we are, and this is the reason. And again, I don't know what I'm doing, but I know why I'm doing it. And I've had so many conversations with people, and the lack of resources, there's like such barriers already.
Uh-huh.
Like the
You're right.
degree of effort that you have to put into just getting out of fucking bed to go
Right.
to the doctor.
Yeah.
So like, yeah, do you see me getting amped up? Yes, you do. But this is who I am, this is how I am. And I feel so strongly about this because I'm tired of seeing people suffer unnecessarily. And that is the point. Like, I hope that there are some neurosurgeons watching, and I don't want to piss you off, but I'm prepared to piss you off.
Yeah.
That's how I feel about it. Like,
Yeah.
I don't give a shit if I hurt your feelings. I want you to listen. If I happen to get your attention by pissing you off, then so be it. But pay attention to what is working and get over your ego.
Exactly.
I'm
Right.
sick to death of these egos, which, by the way, I do want to say I think I'm taking a good look at the whole picture as well. Like, I understand that you went to school for a tremendous amount of time and you dedicated a lot of your life and resources and money to your craft. And I appreciate that. I do. I deeply appreciate that. But it doesn't mean that you're always right. It doesn't mean that
Exactly.
somebody else hasn't potentially found a better way. And I know that it's not fun to have people come in and tell you how to do your job or whatever, but to completely dismiss that, like, think of just try to be better about it. Like,
Right. Yeah.
be better about how you, like, how you react to the question, because when somebody is feeling like no hope, they have little to no hope for their entire, when they think of their future and the way their life is going to look, and they don't see anything but bleakness. And you can't, I can't relate. I can't. I can only relate from what I observed, but to watch my son like intentionally avoid laughter, like
Right.
he would not spend time with his best friends. That's all his best friends wanted to do, was come lift him. They wanted to come be with him and help him and cheer him up. And it's beautiful that he has that crew. But it was like, it was this trade-off, right? Like he wanted to spend time with his friends, but then when he would spend time with them and he would have a good time with them, the price that he had to pay for it was becoming so much that it was becoming like not worth it. And he was absolutely losing hope. And he was like, you know what, 18, and thinking that this was going to be his life. This is, he was like, okay, this is going to be my life. And it's it needs to be part of the equation. The compassion and the empathy needs to be back in the room. It has to be part of the experience. And this dismissiveness of symptoms and the dismissiveness of questions that are valid, when people are seeing the experience that like my son had, which I, you know, I'm a super hippie, and I believe in some stuff that people don't believe in, but like I wore shirts that I believed that were like placing orders, and my shirt said gratitude, grateful. I have a purple one that says grateful, and I have a black one that says miracle on it. And I still wear those shirts all the time. And every time I wear them, it makes me think about, you know, the experience that we have there. But those are the two biggest things. And I was like, it feels like, it does feel like a miracle, because his outcome was, I mean, a lot of it was instant, but he did over time, over several months, continue to improve and continue to get better. And it's like basically the exact opposite of like when you're watching somebody slowly decline, and the hope, the light just starts to go out. Like it just gets dimmer and dimmer and dimmer, the hope does. And then you see somebody like my son have that experience, like right after surgery. It was like light, sort of like sparks all over, you know, like, and it was beautiful. And then it's this recovery that takes place, and the light just kind of continues to expand into more and more hope. Because there is a part of it, I think, that, you know, you get to this place of desperation and so feeling so hopeless that you're afraid that what if it doesn't work? God damn it, what if it does? What if it does? And the doctors here, you need to get on board with that. You've got to get on board with this. And
I'm glad you mentioned your son's age at 18, because I forgot about that. That was the third big thing. Well, at your age, you're going to start experiencing. And I mean, I had I'll say common folk, meaning friends, family, say that to me. You know, well, you know, around that age, you start to.
Right.
Oh, I have headaches too. And I'm like, oh, these aren't normal. I have the normal ones also. So the age factor, your son was to the point of not getting out of bed on some days.
Oh yeah,
absolutely. Well, it's not because he's 48 or 9 or whatever. You know, it's debilitating. And and I even tried saying, it's like her son is having the same symptoms. Is it age? You know, I would smart back and say that to people, you know, because I was getting bitter, and you know, about
100%. Yes.
And with something's congenital, you're probably born with it, or an accident caused it, whatever. You know, I don't think they've figured all that out either. It's not fair to brag on your health and say, well, I did this, and this, and I'm a perfect health. I'm on no meds and I'm older than you. Okay. It's a brain deformity, or I don't even know. It's something you're born with. So you're tagged with so many things other than the symptoms. Like I haven't even touched on the symptoms. There's so many, but like you're tagged with people giving you a hard time, people diagnosing you, take this, take that, bragging because they don't have the problems and they're older. Then you got the age factor, anxiety, the migraine. There's an excuse for everything. It can't,
Right.
you know, and so like the laughing thing, I did the same. I feel for him because he's a kid, you know. It's like not, you know, just laughing. I didn't want to go out, you know, couldn't talk right, you know, face was going numb and starting to pull down. I mean, it was right. It's like your life is just, you know, everything.
The quality of life, the quality, it's really about the quality. And you know, everybody, it doesn't matter how old you are, everybody deserves to laugh. Everybody deserves to have that, you know. And it, you know, that might be a small thing. No, that's a big thing.
It's huge. You don't realize how much you do it.
Yeah. And so you know, the culmination of all of the things that people deal with that are suffering from Chiari, and then being dismissed about it, it's just not okay. And I don't know that there's a whole lot we can do about it, but like right now, hell, I'm here I come.
Go, girl.
Okay? But today, for anybody who's watching, like my hope is that at the very least, I hope that you feel like somebody understands and that you're not crazy. You do deserve to have laughter. You know, you do have there is a community of people out there that understands that you can become a part of. You know, go on Facebook and look for Chiari support groups. There's a few. You know, our first neurosurgeon told us, he literally told us that, and that is the worst advice I could have gotten from anyone. Also, just so you know, he told my son it was okay to play football.
Oh my gosh.
A neurosurgeon told my son that it was, the only reason we went was because he had gotten a concussion from playing football. And it's like, that's how we got the diagnosis. And then I asked him, I was like, well, does he have any limitations? Is there anything that he shouldn't be doing? Oh, no. He can play football. I have that on record. I've still got the recording. Anyway, you know, like it's crazy. I could go on, and I'm going to on several different interviews with different people. I do want to kind of bring up, because it's just one of the things that I have the hardest time with, because there are several questions that I get on a frequent basis, and I think it's because we did have the surgery in Barcelona, and because we had such great outcome. I have people ask me all the time, well, why don't they do it here? And I don't know. I don't have an answer. I have no idea. There is no question I would love to have answered more than that. I have the same question. I'm not sure, but I will say that if you Google, and I've said this on my, you know, probably on both of the other ones, but this is one of the pieces I personally really want to get out there. Neurosurgeons, hope you're watching. Riddle me this. Okay. Yes, riddle me this. Is if you are saying that you believe the cause of Chiari to be a misshapen skull, and that you're not sure, okay, because we know that that's a theory. So you're performing incredibly invasive surgeries based on a theory, okay? But you say that the reason that you won't do the surgery that they perform in Barcelona here in the United States is there not enough evidence.
Yeah.
I don't understand. You're gonna have to come up with a way to get that through my skull. Like I've said, the math's not mathin'. There's nothing about that that's okay, because they've been doing that surgery over there for over 40 years. So you're doing a barbaric, brutal surgery, cutting out the back parts of people's skulls based off of a theory. I want you to remember that.
And they come out and say, even the really, really good ones, they flat say, this isn't a cure. Okay.
Yeah. And by the way, they say that in Barcelona too. That is absolutely, they are very clear about that. The surgery in Barcelona is not a cure, that the intention is to stop the progression. Yeah. And I believe that it does so very successfully.
Yeah. Well, and I guess in my little brain, which is actually, I guess, big.
Yeah.
I guess. I mean, you know how you read a magazine about health facts. Now we read online and those health facts are different. And eggs are great. Eggs are not great.
Right.
Everything changes. Science changes
Mhm.
constantly.
Mhm.
Why are they stuck on that? Because the friend that I referred to earlier was back in the early 2000s. We've been doing the same thing for a long time. So
Yeah.
why in the world are you not thinking, new answers come about?
Right.
Things
Right.
change. Put a trial out there. I'm game. I'm desperate.
Right.
I will do it,
Yeah.
So I don't understand, like, if a normal folk can think that way, and we know it's
Mhm.
kind of a fact of life, why dismiss it so easily when there could
Mhm.
be a simpler answer? I don't that I can't wrap my brain around, like, why it's just
Right.
no, we got to cut your skull, you know.
Yeah. Yeah. And I don't like, I've said so many times, like, I don't care if I piss you off. I'm not trying to be difficult. I'm not trying to be an asshole. I'm just trying to get the conversation to a place where it's being taken seriously.
Right.
And it's not just dismissed as it's been. And I don't think that neurosurgeons get into this. I believe that they do this when they decide that's what they're going to commit their life to, and they're going to dedicate their life and their resources and their time to doing. I believe they do that because they want to help people.
I do
I don't
too.
think anybody's going to put themselves through the things that they go
No.
through because they don't want to help people. Like, I know that's why they do it. So I've thought about that a lot, and I've had some conversations actually pretty recently about that, and with some people who are kind of a little bit more in the medical field, who maybe I'm like, well, maybe they can shed some light on this for me. Because I know I can be wrong. I mean, I have no problem. I have no problems at all be accepting or acknowledging, like, hey, I was wrong about that. But my thing is, like, okay, if they're doing this because they really want to be helpful to people, I get that they're like, hey, I did school for this many years, I already know what I'm doing. 100%, I get that. But where did you learn, and who did you learn from, and who's making those decisions?
Right.
Like, let's follow the money. Let's find out who is determining that this is the best approach. And because if, of course, if you're going to school and this, like, you're gonna with the lack of a better word, like, believe that that's the best way because that's what you're being taught. I get that. But why is that the one being taught? Like, why are we not, like, expanding into other opportunities that are clearly available to us at that level?
Right.
Why is that not
Was in
happening?
my head also. I was literally thinking that, like, in the hierarchy of every job, there's always someone above you. Even when you work for
Yes.
yourself, your customer technically is above you. Customers
Right.
are right. So who's above them?
Right.
That they're not willing to take this new information to. Like, why is it being dismissed so easily like that? I guess. There's usually just always someone.
What has happened? Oh, did it your side too?
Yeah.
Okay.
You're back. You're back.
We're back.
Okay.
So I can't help it. I get pretty amped up about it, but if I wasn't amped up, I wouldn't be doing this.
Right.
And that's like, it's my baseline. My baseline is just go for it.
It's mama
Figure it
bear.
out as you go. So I don't know. I don't know if I'm asking the right questions. I just hope that that even just one person that could be watching this today is like, oh my God, yeah, I also, because Ashton, the kind of bringing us back to the first part of the conversation, when I was saying, hey, I was just so happy that you were, like, able to talk to Ashton about symptoms, because he had that too. And I didn't know. I had no idea that he had, like, a sensation of things crawling. But that was normal. To him, that was normal, and he didn't know that wasn't normal.
Right.
So the symptoms are, there's so many, and they intertwine and intersect in ways that, if you don't have it, you probably can't understand. And I guess I do have a question that I hope, like, when I was before Ashton's surgery, that's what I spent almost all my time doing, was just like trying to figure out symptom management, because he was just in such a bad spot. Like, what can I do? I can't like do any surgical, like there's only so much you can do. So as a parent, I was constantly looking for anything that I could do or offer him that would give him any relief. So you and I had conversations about that, and you were able to give him some tips. So I guess that I would love for that to be something that you might be able to share, if you found anything that you've kind of relied on that you have, that's been helpful to you.
I did with my husband, we invested in a sleep number. To this day, I sleep inclined. That's helpful. Now, the pillow you sleep on, that can be you could wake up in a flare up and be down the whole day. And I kind of rigged my own, but I didn't buy one. There are special pillows out there that are they were created, I think, from Chiari parents trying to help. But so I just kind of, it's a certain way. I put a couple different pillows. I just went to Dollar General and built them out. It wasn't about money, it's about how it hits your head and neck. And so I have the one, I'll take it everywhere because I got it rigged just right.
Yeah.
So yeah, I have an ice wrap that I have. It's just, I keep it in the freezer, and then I have a really big ice pad. I will put the big one on my whole spine, especially when my spine is hurting the most. But I notice when my spine's hurting, my ears are also just screaming. So that's a symptom, but it's just screaming, like so much noise. And then I'll take that really cold wrap around my neck, and that helps me. Like, I only take one medication to keep my blood pressure up. Everything else is Excedrin, migraine, or something I just do on my own. Like CBD, sleep stuff for night, things to calm my brain down. But the eye thing is, and coffee. It feels all right.
Ice, you said?
Put that thing as in coffee.
Oh, okay. The internet connection kind of weirded out again for a second.
Like, I wake up and I'll be like, oh no, not today. And I'll start sipping coffee. If you look at Excedrin migraine, there's a caffeine is in there. So I'll sip coffee, I'll put the ice ring around my neck, and I'll sit up and just breathe nice and slow. And I think sitting up even further helps things. I try not to do too much jumping around. I try to think of like little tips. Stay hydrated. I can't stress that enough. Put a little sea salt in your water and lemon juice, and your electrolytes, because probably dysautonomia is part of your diagnosis because of Chiari. I was diagnosed it as idiopathic autonomic nervous system dysfunction by the second doctor, and that basically means my eyes don't make tears like they're supposed to make tears. Like they dry. My skin explains why I've been crepey for a few decades when I should have been. I might suddenly, it's not, of course, it's just your age and hormones. No, it just broke out in this weird sweat for no reason. It is not, like your body don't regulate sweating, all that. So just stay hydrated. I would say 80 ounces, your body weight plus, as much as you can, because more than likely your body's not regulating how much you have to go to the bathroom. It all just like is a big walk on my eggshell body situation, which is very annoying because your social life is just kind of like, I'll be there.
Yeah.
So I would say start with hydration, the ice pack for your necks, just for the immediate relief. It may not take it all away, but it will help a little bit as far as getting you through. That I have an ice pack for my spine. I put it on isn't it ironic that my low spine is so messed up, and that's where the Barcelona surgery is, and the discs that are both shot are next to where I mean, if you think about it, if a tight vellum whatever pulls your spinal cord, wouldn't it also affect the entire spinal cord? To me, it all makes so much more sense.
Right.
Than starting here. If you start down here,
Right. Well, and if it's a like very minimally invasive approach to start with. That seems like a
Yes.
better way.
Let's replace
Yeah.
the spark plug before we do the engine.
Yeah, for real. So, okay, so you have all the MRIs you need then now to send over?
I think I have, yes, I have the brain neck combined. They did it differently. They did not do the flow. They said they were going to do I've never had the ink stuff. I was a little concerned about that. I probably eat enough pain as this. I was like, oh boy. So I did the one where you have contrast. And then I have thoracic and I have lumbar. I have weird x-rays, but I don't have a full standing x-ray that I would need. So I just need to request that somewhere. And that one, people look at me like, and I was like, like for scoliosis, I try to explain it. So I think I can probably get that at the new, bigger place. Here, they would have to puzzle it together, is what I was told.
Yeah, which I think you could probably make that work.
Okay.
For Barcelona. So I don't know. I don't want to speak for them, but they were able to make ours work. So
yeah. Well, it sounds like it's a little. It sounds like Barcelona will work a little bit, knowing we may only be able to get so many tests. So
right. Yeah, I think they're just I just think it's a good insight to just like the difference in the care you get there. I'm telling you, I'm getting emotional thinking about it because Shelly, we didn't have the type of experience you had. Like, as far as the dismissiveness, that I don't know that anything bothers me more than to hear that from and to see that from all these posts on, like, for people to be in that dark, feeling no hope place, and so terrified. Like, it has to be absolutely terrifying. And then, I think that it's really important too. We might circle back to this in a second, but you have spoken before so eloquently about basically like you had a grieving process. And I think that needs to be part of the conversation as well. Not because you need to have a grieving process. I don't know how to, it's like a little bit weird because I'm like, I understand why that's been part of your process. I feel so grateful that I don't believe Ashton ended up having to have that. I feel like he was, but now we're on this other side of it, right? Where we're still seeing the light expand. But I think that that's something that, is very much something that what I'm observing is most people go through so silently and isolated, and not really knowing that's what's happening. And I deeply respect that you recognize that for what it was, and could verbalize that in a way that kind of gives gives people permission to go ahead and just do that. Like, it's understandable, because if you're in a position where you believe that your life is like kind of doomed, I don't know other way to put it, but you would have a grieving process of what you thought. You would have to grieve what you believed you were going to have and that you might not have. And so I just, let's come back to that in a second, but I do want to kind of finish my thought about like just how beautiful that they care for people in Barcelona. I can assure you, I promise you, you will not feel dismissed. You will never feel more seen, heard, understood, cared for. Like, it is a totally different experience there. They get it.
I think that's something I can't comprehend. Like, I can hear you, kind of like, but it's like, huh? I went to a holistic doctor once, and there were plants and pretty Zen music, and that felt pretty good. I was trying everything.
Right?
This is so much less anxiety than the stark, mean places.
Yeah.
But like what you're describing, It's kind of like how you described not completely understanding Chiari, but it's like you say that and I'm like, they care? You mean they'll, I was like, what is that even like? But,
Yeah.
mhm.
Yeah. So if you're comfortable with it, do you mind talking about like those two emotions that the anxiety? I think that's a big piece of it, because I feel like this is just an observation, but it feels to me like a lot of people are like basically just diagnosed with anxiety and they throw pills at them,
Yes.
which maybe that's appropriate for some. I'm not saying
Right.
it, I'm not making any medical claims, okay? Because I'm a moron. So let me just establish that. But I do think that from observation of my son and my conversations with you and several other people, is that like just from a logical, practical standpoint, if you are waking up in the morning and before you can do anything, you have to take inventory of basically a head to toe inventory of your body, right?
Yeah.
Like I personally don't have to do that. I could just pop out of bed and start doing my stuff. So I get I don't know it from experiencing it. I know it from watching it. It has to be a very thoughtful approach to how you even get out of bed.
Right.
That's how you're starting your day is,
Yeah.
okay, is it safe for me to
Good
move
word.
this direction? Is it
Right.
safe for me to sit up? You have to be so careful. And then when you're approaching your day like that, and then you encounter, what other, maybe a person or whatever, like if you are trying not to laugh, if you're trying not to sneeze, if you're trying not to cough, then if so much of your effort of your being is avoidance of normal human behavior, then you have to, it only makes sense that your anxiety level would be at a constant, like basically state of panic. I mean,
Right.
let's call it what it is. You guys are in fight or flight like almost 100% of the time. And
Yes.
I mean, the damage that like just the level of stress and like emotional and mental stress, the cognitive load that it would take to be so like aware of every move that you make. That's a huge cognitive load. So I think that throwing anxiety pills at people may be helpful, but I don't know that it's like the I wish that they could see it for that's actually why the anxiety's there.
Right. Then it is listed as a symptom. Depression is listed as a symptom. The top, since mental health awareness is becoming bigger,
Yeah.
and we're trying to push for people to feel okay and that you have permission to get help, that it's you need to reach out. If I hadn't told a whole bunch of people that myself, I would have never searched in that group. I started to like, okay, what would you tell someone else? As I'm on my hands and knees bawling. And I remember having those little critters outside that look like sticks, prairie mantis kind of thing. I don't know. I had it in a jar, and it was my grandson's, and they had left it there. And I saw a butterfly. I couldn't feel joy. I saw everything, the golden light, I couldn't feel. And I was in a place that was really, really, I remember just crying and saying, thank you, God, for letting me experience this. So someday I can help someone else, because now I get it. And I looked at that prairie mantis stick crawling thing in a jar, and I said, that's what it's like. You're in there, but you're enclosed and you're trapped. You can see everything happening around you. You can't have the senses, the sight, the smell. None of that operates anything anymore. You're just trapped, but you can see. That's about it. You can't feel it, and except for the pain. So I let the little guy go because I couldn't take it anymore. I was like, he needs free. If it was me, I want to be free, let him free. And so I know that's really kind of far out there. I am definitely woo-woo, but sometimes in those moments, it's those little things that speak to you. And I was grateful and I know it's kind of made fun of by medical people, like, well, I found on the internet. Well, don't push us to have to look for our own stuff. You know, that's what pisses me off. And then I'm like, in a Facebook group, that's kind of funny to them too. No, these are people actually experiencing what I'm
Right.
experiencing. And then my brain went from that, like all those stages of the grief. You know, at one point I was in anger. More than once, but at one point I'm like, I am paying you. That means I'm the customer. That means you work for me. I mean, I just started getting mean. I mean, that's not me. It's aggressive.
I'm aggressive. I'm baseline aggressive.
Another tip that just popped in my head: when you call and they're wanting to blow it off, is you start the sentence with, "I want this noted in my medical report." They have to. And then you state it, because if they don't, they're held liable for not taking that seriously. You know, okay, so today I completely lost control from here down, blah, blah, blah. Please note this in my medical chart. And it switches things. I got a response that was completely different. I don't understand it. I just did it because someone told me. So if anyone try to get, you know, to be taken seriously, throw that out there and see if it helps, you know.
Great advice.
Yeah. Because
super solid advice.
Yeah.
Wow. Shelly, how did you find the strength to be so helpful to other people when you were dealing with this yourself?
Because I know there's not many out there. And if well, there, and I'm not going to go religious or spiritual on you. It's just, there was something.
Whatever you want.
Okay. It was, now watch me not remember anything, because, you know, I have no short-term memory left after all this. I just play with it. I was like, huh? But anyways, I think it's 2 Corinthians chapter 1, and I read it, and it stood out to me that you go through things. I'm paraphrasing huge because I'm Shelly, and I'm not complicated. You go through things so then you can help someone else. And that has hit me so many different times for so many different things. And sometimes maybe I tried to be too helpful or talk too much. You know, you have to learn how to be helpful. Sometimes you just need to listen. And I kind of will get nervous and ramble, which everybody has proof of now. But I went through that. Someone else is going through that. Do I want them to be in that dark place where they're staring at a prairie mantis in a jar and their life is just like, you know, you're like, you feel done and you feel robbed. You feel crazy. No, I don't want anyone to experience that, you know. So if I can help anybody or bring up weird symptoms to help them be validated and not feel like they're crazy. And as the old saying goes, you're right, it is all up in our head. It's called Chiari.
I'm not arguing that. And partially down my spine now, thank you.
Yeah, thank you very much, America.
Yeah. I didn't hear what you said, but I saw this. I'm gonna have to go back and see. Oh my gosh, you have been so fantastic. So I do want to ask, like, what do you wish people who don't have Chiari, what do you wish they understood?
It's like, I get it because someone else going through something and I'm not. I can have sympathy, but I can't have empathy. So I don't expect empathy, but I think sometimes the reason I would, you know, even like to my husband, you know, I would say things, this is going on, you know, like that. It's because I just wanted them to believe me. And I felt like when I didn't say anything, people just thought, you're fine now. It went away, because it's like the flu. You got it for a week and it's gone. You know, it's something that will just kind of go away. Don't tell people it's age. If you don't have things, if you don't have a chronic illness, be thankful, be grateful. That you, like, just really understand that that's a blessing. Don't brag about it to someone. It's like winning the lottery and you know your neighbor across the street is going through a financial difficulty and you run across the street to tell them about it. That's probably not the best time.
Right.
Don't do
so
that
much.
hope-wise. Just listen, just
Mm-hmm.
believe, and maybe even just ask, what can I do to help? And if there's
Yeah.
nothing that we can verbalize, a hug. Some people are huggers. I am, but do it gentle. It's just,
Yeah. Right.
we don't expect you to cure or solve the problems. We just want to be believed.
Yeah.
And, like this, like I said, the simple question, is there anything I can do? But don't offer up all the, I think that's probably more so people wanting to help. Have
Yeah.
you tried vitamin D?
Right.
Yeah.
Yeah.
So,
There's a lot of that. Yeah.
yeah.
From people who don't have Chiari, but they're like, I want, oh yeah, I do,
I had
whatever supplement or,
one of those symptoms once, and this vitamin helped that one symptom.
yeah. Yeah. So that leads me to another question. And maybe if there are parents who are watching, hopefully this question could be helpful. So one of the things that I found challenging was kind of the same thing that you have. It's the same struggle as a parent, no matter what. Is like how not to be too hard, how not to be too soft. That's part of parenting, no matter what, right? But I
Right.
think it was amplified when it came to Chiari stuff, because I didn't want to be like babying him so much that it was offensive, like as if he couldn't do anything for himself, right?
Right.
But I didn't want to I wanted to be as helpful as possible if and when he would need help. And I think that I know I'm not the only person that was trying to navigate that. And I think that it could shift, moment to moment, really. I mean, quite frankly, literally moment to moment. But
Yeah.
I don't necessarily, I mean, we didn't really have any big problems with that or anything, but I do think that it can be a component of this for any caregiver, of how to sort of approach what's the best way a caregiver can be uh you know available without being too much.
Um, that's a good one. I think, like in my home, like just knowing they're there,
Mm-hmm.
and how some people may just stick their head in their phone, to the screen, and they're not there.
Mm-hmm.
Being there.
Okay.
If I'm having a hard time, if you just be aware, and just, you don't have to be overbearing, but be aware. If you see, like, one of my main symptoms getting up in the morning that was real rough is sitting up super slow. I had to hold on to walls because I would run into the opposite wall. If I tried to go one way, I'd go the other.
Oh my gosh.
So that is still there. Some mornings are really bad, so I just walk and I hold everything. Like, if you see me struggling, offer to help. Are you okay? Do you need help? When you're around someone a lot, you they're not right. You can see it in their eyes. So
Yep.
I still remember, it was so sweet when, like, Tony, my husband, like, I would come home from school and the sensory disorder everywhere, and I'd walk in and I would try to hold composure, and I would just be that, and we always hug and give a kiss, and I look up at him and he goes, "You're not okay." There it goes again. And he's like, and I would sit there and I just start quivering and tears would run down my face, and I'm just like, everything is going off. I said, it's so much. And he would let me, just, not that I needed permission. Let me is kind of a weird word, but like, go sit down.
Yeah.
Here's your ice pack. And he didn't know how to fix anything. That's so hard for a caregiver, but sometimes you need permission, and he'll be the one that'll say, he knows I can't nap. I cannot nap. I mean, it's just, and he'll be like, just go lay down. And you feel like society makes you feel bad when you're not constantly go, and you're not accomplishing something. And to have someone give you permission to rest and tell you it's okay, and to listen to your body, is amazing. And he was so good at that, and even knowing half the time, he's like, what is going on? That was Oh, he's a patient man. But yeah, there would be days I would text him and just like, I'm so sorry. I'm not able to do this. I'm wanting to do all this. And he'll be like, baby, go lay down.
Yeah.
And I was like, almost need is like a boss to tell me, all right, it's time for your federal required break.
Right. Yeah, so he could just like that's what you mean by giving you permission, is like,
Yeah.
he'd be like,
Yeah.
okay, you've got to go, like, you just go do that.
Yeah.
And you're like, okay, it's
Right.
acceptable for me to do that.
Right. And I'm not
Yeah.
implying at all that I need his permission. Sometimes we're the
Right.
ones hard on
Yes.
ourselves because we're not accepting what's going on. And
Mhm.
so acceptance isn't there. And I don't know if it ever will be, you
Yeah.
know, but in our society, like, you know, other countries, they stop and take naps and have tea and do the cool things. And then we got this one, they're like, you know, on the, come on, back to work, back to
Right.
work, to work. Like, you don't have worth unless you're
Yeah.
doing these things. And I would say, by asking,
Mhm.
it gives myself permission when I hear someone say, you know,
Yeah.
you need to stop, get
Right.
your back. And then he'll joke around. I was like, I tried to tell you it helped, you know.
Yeah.
He'll make a light of it later, you know, like,
Yeah.
he'll put the ice
Well,
back on. Just a little
you
better.
guys are really good at that too. I mean, both of you, that's something else that, you know, I have observed, at least, is like there's still humor. You guys have somehow, like, you sort of have that as your like foundation, or maybe it's just a lifeline or something, but you both kind of like, you know, you're
We
able to
want to
get to a
laugh.
place of humor pretty quick.
Yeah.
So you know, it's definitely something that I don't know that you can teach. I wish you could, but I am assuming that has been part of like the things that sort some of the lift for you, is just like being able to find some humor. And then I would also assume, no, I don't know, like, again, I'm wrong all the time, but I would love to know, like, how has your art helped you through all of this?
um the it, it's sometimes the hardest part of any job is starting.
Yeah.
And I heard that in high school, and it's the same. Sometimes it's a job and I'm going to do it, but
Mhm.
minute I lock on, I put on a podcast or pretty music,
Yeah.
it takes me away to another
Mhm.
place. And when I'm there, then it's hard to stop. So
Mhm.
but when I'm creating just for myself, which I don't do as much as I'd like, because I'm trying
Mhm.
to keep up with the things like commissions, you know, it's kind of a
Yeah.
trap. It's a happy balance. So always try to
Yeah.
figure out. But when I'm just creating for myself, it's almost
Mhm.
like something's released.
Mhm.
When I and I have to go about it with, I'm not doing this because I hope to sell it and I want to pay the electric bill. I
Yeah.
have to go about it with, I just need to create something and I don't care how it turns out. And that's hard for Shelly.
Yeah.
So I was like, well, that was a weird move. I do better like in that regards, abstract, you know,
Yeah.
or hints of subject matter that's distorted. I've used art my whole life for very cathartic reasons.
Mhm.
Like emotions, I like to make tangible
Mhm.
somehow. And I think it's kind of similar, like someone like they get a tattoo and they feel better. Some of that might be the pain, but like, but
Mhm.
it's an outlet.
Mhm.
I want to see and touch something that feels out of control emotionally. And when I create it, I have an art piece, the whole bottom corner. I never used water. It was watercolors and illustration pens. It was all tears. Like I made the spiral and I'm crying and it's dripping on the
Oh, wow, cool.
watercolor paper. And when I was done, I was like, okay, I feel better. You know, I wasn't perfect. No one is, but you know what I mean? I was just like, oh, it was good as I used to be able to run before I had a boo-boo. No, but running would give me that same high, that same feeling, you know, just it's a release. And then you need it again. But yeah, so art is very helpful. It's very therapeutic. And if anyone out there is not an artist, I still would encourage you. I mean, get some kid finger paints. It doesn't matter. There are no rules.
Yeah.
Just, like go to town and I do a couple deep spirit energy cleanse paint classes, and
Cool.
not everyone in that is artists, but when you're throwing paint, thinking about something and I'm wanting you to discard it onto that canvas, there is something that happens that helps release some things within you. And so
absolutely. Yeah.
go outside, throw paint, splatter paint, smear it, paint the dark thing, then put the happy things over it, just use color to express yourself.
Yeah.
That would, sorry, my legs started going to cramp. Just random, but
there it is.
But it's kind of like Lamaze. You never knew how many helpful things it was going to.
Oh my gosh.
Yeah, I'm good.
Yeah.
Yeah.
You're still sort of figuring it out too, right? Like,
yeah. There's some things, it's just my body is like walking on eggshells.
Yeah.
You just don't know exactly what you're always going to be dealing with. So there's that. My mind's going here, I'm like gonna do this, and then my body goes, oh yeah, we'll see.
Not so much.
Yeah.
Well, I mean, I know, you and I have had this conversation a few times, and I know the last time I talked to you, I've always been like, I don't ever want to tell anybody what to do. It's not my body. And I still absolutely your body, your decisions, all of that. And at the same time, I'm like, I'm just going to be honest with you. I am going to try to convince you to go to Barcelona. Like it's your choice, but just know that I want that for you. You deserve it. I know there's more than one thing to consider, but we can have another conversation about that if you want to, offline. But like first, that just for anybody who's watching, you don't have to commit to anything with Barcelona to find out if you're a candidate.
That's true.
So you could just do step one, and you literally just said the hardest part of anything is just getting started.
You just used it against me.
Just saying, you did just say that. So if the hardest part is actually the easiest part.
Yeah.
Because all you have to do is send them the images that you already have.
Yeah. And you said you would be able to help with that, like how to get there.
Of course. Yeah. Of course. Yes. All you got to do is just say, hey, this is me. Here's my images. Well, hey, this is me. And then they'll be like 2 or 3 emails exchanged backward, back and forth. But they're gonna take a look at that, and they're gonna be very thorough. And that's the thing that I kind of I'll take a real quick moment to say they're so much more thorough. They are so much more thorough. When we were in the day that we arrived, the day that he did like the full neurological testing, which sounds scary, but it's not. It's actually really fun. I promise you, it's actually fun. Like I would love to relive watching that. It was so great. But they showed us a video, and they answered questions, and they explained things in a way that it's never been explained to us like that. So it was just kind of like your metaphor was just, it's such a beautiful way to be clear about things. You were talking about the wine cork. It's understandable. So imagine that, but and apply it to every aspect or every facet of the Chiari experience. It's that's what you get over there. It's like clarity. It's you're getting recognized. You're not being dismissed. You're understood. You're welcomed. You're received. You're cared for, and things are explained to you in a way that is so refreshing and so acknowledging and validating that it's just experiential. It's really hard to put into words. But for example, I will give an example. Every image I've ever seen in the United States has only been like a profile image, right?
Okay.
So just like the side, and they show the dissension from that profile. But that's only showing one side of the brain, because the brain has a right and left hemisphere. So you actually have 2 separate
tonsils.
2 separate tonsils, and Ashton very clearly had one longer than another.
Oh, okay.
Anybody ever? No, they're not even going to look, right? They're not even going to look in the United States. So that's just what I mean about how thorough they are and how well they look and care. And so I just think it's important to say. And so you can send your images over, and they're going to have a look at it, and they're going to have a very thorough look. That's why they ask for as many images as they ask for. And you have to fight your ass off just to get an MRI in this country.
Right. To get it even approved.
Just to get an MRI. So they're asking for all these images because they are that thorough. So they're going to take a look, and they're going to get back to you, and they're going to get back to you. You know, it's not going to be immediate, but it's not going to be that long either. So I'll just put this out there real quick, and then we'll probably wrap up, because we've had a pretty lengthy conversation. We'll probably do more, but you know, I think one of the big challenges in the United States too is just how long it takes to even get into your doctor.
Oh, that is
It
not
takes for damn ever.
Yeah. The new one, I think I waited, a few months just to have that initial visit, which is nerve wracking because you're restarting over, you know, like every doctor you go, you tell the same stories over and over again, trying to, you know, like, read my medical chart, stop this, it's a waste of time.
Madness. Yes. Yeah. And so, I mean, I think that's it's not a bad point to, like, just kind of bring up in the conversation, because it is such a normal experience in the United States for people to wait months and months and months. And so that was definitely Ashton's experiences, because we wanted to see the doctor that you had, because he was, like, kind of everybody knew he was the dude, like, in the country. Everybody knew he was the dude.
Yeah.
And you loved him, and he took great care of you. And so that's who we wanted to see. And when I initially called for Ashton's first appointment, was going to be just a little over a year before we could even have our first appointment with him.
Yeah. And so flew into him.
Do what?
That people flew in to see him.
Yeah. He was in demand, and which was reassuring, but it was also like, I mean, I could see it in my son, like, when I told him that to watch his reaction to that was like, that wasn't a fun moment. But the worst moment was when we had it had, like, 9 months had gone by, and so we were getting closer. You know, we had like 3 months before we were going to go see this doctor, and they called and said that they were going to have to postpone it. Something had happened, and they were going to have to postpone his appointment. And they were adding another 6 months onto it. So it really was going to be an additional 9 months from that date before we were going to be able to see him. And when I told Ashton that was that it was obvious to me that was his lowest point.
Right. Yeah. Because he's going to keep declining, and every day is getting worse, and he's living in that. And this popped in my head. I'm going to throw it out there for caretakers, and I know you could verify it. Not every day looks the same. You could have an up day, then you're going to have a low day. You might do this activity and you actually got lucky and it's okay. And then you do it again and you're punished. Your body punishes you for it. And so I can see to the outside world, okay, well, that wouldn't bother you that time, but now it does. But it's that crazy of a thing to deal with. And then Ashton is 18 going through that. It's not age. So he's 18. He can't live a young person's life. And he's told he's got to wait 9 more months. That may not sound like a long time, but it's horrid when you're suffering. Yeah. That's a long time.
Right. Well, and when you have that sort of like thing on the horizon, right? You've got like, this is okay. I've just got to make it there. He had that in his mind, like, okay, I can do it. I've got, and the weeks are starting to chip away, and we're like, okay, we've got, there's 5 months left, and then we get through and then now there's 4 months left. We get to this, okay, we've got 3 months left, and then it's like, psych, like, nope, we're gonna make it 9. And it wasn't, obviously it wasn't malicious, it was just, it was what it was, but it was devastating to him. It was it was I had real worry at that point. I was like, it was not a good thing. So thankfully everything changed, and we found out about Barcelona, and we did that, and he's totally fine now. But and I mean totally fine, like totally fine.
Oh, that's amazing. That's amazing. And I will admit it, you would think by somewhat time, I mean, I'm going to be 55, and so in August, so you would think I shouldn't care what people think anymore, but I do. So like the Barcelona thing, I'm in a small town, people are going to think I'm nuts, and I'm going to have to say, I don't care.
Yes.
And so it's worrying, you know, you're going to have some, what is that called? Backlash about it.
I guess. I mean, but
You know.
we're in, you know where we are. We're in a really small town too, and we didn't get any of that.
Okay, you didn't. That's what I was
No,
more
not to my
concerned about.
knowledge. I mean,
Yeah.
not that I know of. And then there are a couple other people just from, you know, just from around this area that have gone too,
Uh-huh.
that not to my knowledge have they had any
Any
sort
backlash
of
about.
backlash.
Yeah.
If anything, the opposite. You know, there've been some fundraisers and a lot of support. And I think that
Yeah.
that's, you know, that's hopefully part of this too, is just like kind of being loud about it, you know, and more people know about it, and they have a better understanding of how damn hard it is and how big of a deal it is. And they just want to be helpful. Shelly, and your community loves you.
Yeah. Yeah. I I love it here. So
Yeah.
um I think you know how well anxiety is there anyway. So like to
Yeah.
really get thinking about it, I'm like, oh, I don't know, you know. But and you're right, just sending the things in,
Mhm.
I might not even be a candidate, but then I
True.
at least know, you know,
Right.
if I am a candidate, then you're right. I did get past the hard part because it's intimidating to know how to get the test right and ask for a special one, you know, and then, okay, now I got to upload them to the Ethernet and send it. And, you know, there's a little funny way of doing it, but,
Yeah.
yeah.
I'll help you.
Okay. I know.
Yep. We'll do it. We'll get it done. Wait, what today? Today's Monday. How about we give a deadline? Let's get it done by Friday.
Get it uploaded. Well, I still have to have the full body x-ray.
Okay.
How about today? I will message them where my other MRIs are, because I have to somehow get my hands on these. Like I don't know that I have all the discs. Like I used to collect every little hard copy disc
Yeah.
to take to the next one.
Right.
So I need to start the process of getting the medical records and the disc. Is that what I would need as a disc?
Yep.
Okay. Yeah, I don't have anything to stick a disc even into. So I used to.
Or like maybe, yeah, we'll figure that out. We'll
Okay.
figure that out. We'll, I would assume you could probably just email them, ask them to email you the files.
Okay. All right.
Yeah.
I might try that and then see.
Yep.
I'll at least get that started, because that to me is just like a lot. I don't know, like trying to get the records. And then to get my records from Little Rock to where I'm at now, I bet it took 6 months. And they were saying they sent them and the others were saying they didn't get them. And I had one great nurse. She goes, all of a sudden out of the blue, she goes, you know what? I'll request them. I said, well, I've signed these DocuSign things. I don't know how many times I did it all.
Right. Oh,
I said,
wow.
you should have permission. And that got them like this. And I'm like, but for me to get my medical records from one location to the other was enough of a process that makes the rest of this seem so daunting, you know, like, well, and I'll also put in a message to the nurse and say, I would like a full body x-ray. And things are changing.
Then you'll have everything you need. Yep.
Yeah. And that appointment, you know, like you said, it may be a month or two out. So I need to just buckle down and do that today.
Okay. I'm your accountability partner. And
yes,
I'm gonna text you tomorrow and ask you if you've heard back from them.
Okay, I will. All right.
Okay. Okay. Oh my gosh, Shelly, thank you so much for taking the time to chat with me today. I appreciate you for so many reasons that are, you know, like far beyond just the conversation today. Not that this was just a conversation, but you know, I just adore you. And you know, I know that something that was said today is, if not many things that were said today, are going to be helpful to people.
I hope so.
So you're living it. I mean, you're living in it, and you're living what your intention is with it. And that's beautiful.
Well, I appreciate you for being such an advocate. You know, like I had texted you, I said, I think I lost my advocate spirit, and you pumped me back up.
Yay. Okay.
That great energy about you every time I'm around you. So,
well, I mean, like, I just, I think it's easier for me to do that because I don't have Chiari.
Well,
you know, and the mom energy. I don't think there's a more powerful energy in existence than protective mom energy. I just
Yes.
don't, I really don't think there is. And so it's just, it's not me, it's the energy that I feel like I have the ability to access. And I think every mom can, I think every mom knows what I'm talking about. So,
Yeah. Yeah.
um, I feel like that's, you know, yeah, I'm going to have to just keep tapping into it. And, hopefully, you know, hopefully it works, you know, hopefully it gets the attention of, I don't even know who I'm trying to get the attention of though. That's the thing. It's like, I don't know. I don't know. I just know why. I
Yeah.
don't know how. I don't really know what, other than like, what do I really want out of this? I want this surgery accessible here. Not,
Exactly.
I want this surgery accessible everywhere. I want people to be able to have this option. I want insurance to cover it. I want people to be well. I want the people to be healthy and happy and not have to go through years of torment to get to a simple solution.
Right.
So I'm trying to just like it from like a metaphorical perspective, like edit, you know, like, can we just edit out this useless part? This is
Yeah.
completely useless.
Yeah.
This needs to be, you know, like extracted and taken to the trash.
Uh-huh.
So that's what I'm trying to achieve. But you know, we're just going to keep having conversations and see where it takes us.
Yeah.
So I'm super happy that you have agreed to be a part of the conversation, and I'll probably be reaching out to you again, to do more. So, thanks to everybody. If you've stuck with us this long through this conversation, that means you are either dealing with this yourself or you love someone who is.
Uh-huh.
So, I will do my best to be a resource to you, and reach out if you have any questions. You know, drop comments below that you think, if you've got some valuable information that we didn't cover, by all means, let's like keep the conversation going.